I've got an interesting set of panelists with me who are going to discuss how AI is further going to revolutionize the healthcare space. So before we get into the discussion mode, I'll just quickly hand over the mic to each one of you for 30 seconds each to introduce yourself, and then we'll start our Q&A.
Hello, my name is Dr. Charit. I'm an interventional cardiologist by training and profession. And for the last 14 years, I have been building Tricog Health, which is one of the leading AI companies focused on identifying heart patients and getting them to treatment.
Hi, thank you for the opportunity to be on stage. I am Vishal. I am currently the CEO of the home healthcare business for Apollo Hospitals. It's one of the largest integrated private healthcare providers in the country. I've been in this space for about 8 years, building, I think, to my mind, one of the most important aspects of healthcare delivery outside of hospitals. That's the long and short of me. Thank you.
Hi, Ankit Maheshwari, the Chief Technology Officer, one of the founding team members at Innovesa. So we majorly work with the US healthcare, building out a data infrastructure, what we call the Health Intelligence Cloud, to getting all the data together and providing insights for the patient care at the point of care to help the care delivery. Yeah. So glad to be here.
Hi, I'm Gaurav. I represent a healthcare-focused early-stage VC firm called W Health Ventures. We also run one of India's, probably India's first and largest venture studio called 2070 Health, where we literally build companies from scratch. In my previous life, I've been a health entrepreneur and also was a part of leadership team at Ola Cabs. Thank you.
Thank you. Can you hear me? Yeah. Okay. So, Dr. Charit, I'll first start with you, and if you could help us understand how AI has actually changed the way diagnosis happens in the healthcare space. Has it revolutionized? Any use cases you would like to refer to?
To say that we are living in the most interesting times of human civilization would be an understatement. So there are two graphs that I want you to imagine in your mind. The first graph is this growing population of patients. So think of the fact that there are today, India is unfortunately the capital of diabetes and perhaps even the capital of heart disease. And that graph is only growing quicker and quicker. So the number of patients that are being added, unfortunately, is huge. And there are, of course, multiple reasons from social change, some even technological changes that are leading to the increased burden of disease here in India. So on the whole, India is becoming more and more unhealthy across the parameters. So just to give you one number, the recent survey, the National Home Health Survey, found that up to close to 40% of Indians have elevated blood pressure, which increases your risk for stroke, heart disease, etc. by over 4x. So the patient population is growing. On the other hand, the number of doctors that are there are abysmally small. Think of me as a cardiologist. It took me 11 years of training to become a cardiologist. And there are about 5,000 or maybe 6,000 people for the population of India, and most of us are in large hospitals. So that two graphs, we are not producing more doctors. It is a challenging aspect. On the other hand, patients are only increasing. And how to bridge this gap? The answer is use different modes of technology so that you can create avenues where the few doctors that exist in society today can deal with patients across India, right? And that is where I think beautifully framed is this a cure for Indian healthcare? I think this is a huge boon for healthcare. And I'll give you an example of what the work we do at Tricog. Last week, we crossed a remarkable milestone of serving 24 million people. And amongst the 24 million people that we were able to screen for heart disease, we found close to 1 million patients with critical heart conditions that were sent for further treatment. And this scale of operations can only be possible using AI and algorithms. So just to give you a sense, today we are dealing with over 500,000 patients every single month. And those two able to do 500,000 patients every month and make sure that your accuracies are 99.99 with a very small group of medical professionals. The key for us to enable scale and also maintain accuracy are the tools that the innovators, the AI scientists, the technologists have been able to create. So I see AI as augmenting doctors such as me so that we will be able to treat patients even in the most remote locations so that they will get the same quality of treatment there than they will get at a large hospital setting. So I'm very excited about the future of medicine and AI working together.
Sure. Interesting. So I think so thank you, Doctor. So accuracy is one part which you particularly highlighted. So Vishal, if I come to you and understand in terms of patient care, what more where AI has played a role. I mean, there are some human elements, some human touches, which of course cannot be replaced. So can AI help there as well?
So I think we'll all agree that the human touch and the care element of assisted care can never be replaced by technology, right? Unless you have robots, even then you will need some compassion going into care because care is just not delivery, right? But just to add the argument on out of hospital, right? There are two facets of it. I think if you take any metrics in the Indian healthcare conversation, we are all looking at a crisis fundamentally. We're far more underserved than we think we are, right? And reality just keeps hitting us by the day when you see people in the 20s and 30s getting heart attacks, strokes, etc., right? So it's important that we talk about health, and I think formats like this are important. But if I look at out-of-hospital care, there are two conversations which are far more real. I think one is, as a nation, we'll get elder before we get richer, correct? So that's a reality that we need to accept, and therefore the social care element of it, companionship part of it is very, very important. So that's one aspect of out-of-hospital care. The other is that as we grow older, we're also likely going to be burdened by a lot of diseases, right? And some of these diseases are caused by our own lifestyles, right? So today the hospitalization rate is about 3 to 4%, correct? And with more and more hospitals looking into super specializations, etc., the need for post-operative care becomes even more important. So to my mind, I think on the post-op care, AI does have a huge role. So while it can't really supplement care, it can complement it by virtue of a couple of things. One being it can aid clinical decision systems, support remote patient monitoring, because unlike hospitals, in a home care environment, every home is a hospital setting in itself and remotely distributed. The other is that India is really facing a challenge on the skills side of supply. While there are not enough number of nurses, paramedics or doctors, there's also a skill gap issue, right? So AI can be very, very handy in terms of training, upskilling people at scale and not only supporting delivery. I think just to close this answer, the topic is cure or crisis. I think it's cure for the crisis. That's how we should see AI, right? And therefore, AI is integral to what we do, and the conversation is becoming much more real, right? But 3-4 years ago, we weren't really able to understand what AI can do for us, right? And even till today, I think the core underlying data still remains a big problem to this piece, which we need to solve. But this could be cure for the crisis. But at the same time, as they say, with great power comes great responsibility. So we also have to be well versed of when we are dealing with AI in healthcare specifically, what's the real use case, right? And how do we appropriately, ethically leverage AI to our advantage?
So Ankit, I'll come to you. At Innovator, you have got a lot of health data coming in. So how is that being further utilized in terms of clinical decision making?
Yep. So for us, I think because we operate in the US infrastructure, data has been with them for the longest of the time. Since the Obamacare Act came in, everybody is on the EMR, so the digitization has been there, but it has been so disparate because everybody using their own system, right? You have more than 200 odd different EMRs, different lab systems. So how do you get that data together? To create a unified patient record was the first problem that we started solving with. And once you start to get that and create that unified patient record and have the patient history, and then at the point of care have their current diagnoses, right? And you have all these care guidelines, which health systems like Kaiser's have been working on, they're researching on for the ages, right? How do you combine all these pieces at the point of care at real time has been, I will say, the biggest lever for AI for us, right? That when the patient is sitting in front of you, if you are able to take their history, take what they're describing right now, digitize it on the go with now and like things like ambient dictation, and then marry it with the care guidelines that researchers at the Kaiser, all these doctors have already prepared, which are like 100-page documents. Humanly, it's not possible at that point in time to find what the next best action could be. But with AI, you can do that. You can at that time surface it in front of the provider. And these are the few next best action that you should be taking or you can take, or helping them with things like differential diagnoses over there. Also, like post of that, like working with the care managers, defining customized care plans for each and every individual according to their demographic, according to their social need. If there is a middle-aged woman living alone in a demographic where care is not easily reachable, how do you create their care plan? Who is calling them every week? Have you got your medication filled up? Because if they fell sick, they are going to be a biggest burden on the overall system. I think these pieces, right, the underlying piece is getting the data right first. Otherwise, AI in its primest nature is going to hallucinate, right? When you talk about large language models and so on and so forth, right? They will hallucinate until unless you are able to fine tune them to a particular context. And that is why our belief is like, as in when in healthcare, these small language models built for vertical operations, right? For specific needs, for specific diseases are the ones that are going to be much more applicable, will hallucinate less, and be much more applicable when it's come out. But the underlying data is going to be the gold to direct all these pieces.
Okay. So Gaurav, I'll come to you. You bring the investor perspective to our entire panel. And as a healthcare investor, you're talking to a lot of startups and how they are using AI for the betterment of patients and in the healthcare space. So what new trends do you think are shaping up wherein AI is actually going to revolutionize the entire space?
Sure. Right. So first, let me just put out a very simple framework of how we look at these companies, right? And we divide them in three sets. One is B2B, right? That you are using AI to simplify workflows, clinical, non-clinical, right? And just make lives of the providers much easier, right? And great companies have been built in this space like Innovesa, right? Where they have been able to plug into a lot of large healthcare systems and trying to really simplify their lives and making the data more organized, allowing decision making. So all your companies like revenue cycle management and all that fall into that bucket. That is probably, as of now, the most evolved bucket of all, because the perceived risks are much lower. You are not exposing the technology directly to the patient, right? So if there is any, if AI hallucinates or something like that, you can still contain, and it's mostly business driven rather than clinical decision making driven, right? So that's one, right? And we ourselves have built companies in that space, and they have been scaling and doing very well. Second, I would say, is the model which I like to name as B2P2C, right? So business to provider to customer, right? That you are taking AI, asking it to make a clinical decision, but there is always a provider in front, like a doctor or a clinician in front, who's interpreting that, ensuring that it makes sense, maybe augmenting that, and then servicing the customer through that. Right? And, it's a very well-known fact, Dr. Bhograj also alluded to it, that there are just not enough service providers, there's not enough doctors, right? In US, doctors are burning out like crazy, right? And so there are these assistants which are all voice enabled, they listen to whatever the doctor is saying, summarize it, right? So a lot less paperwork, right? Because in places like US, doctors are spending probably 50% of their time documenting stuff for the payers as compared to treating patients, right? And so this would be the second wave. I think it's evolving very, very fast. Again, there are great companies being built. For example, I would say Dozy is an example of that, or Cure.ai and all that. The third is B2C, right? Where AI is, for a clinical issue, AI is directly interacting with the patient, right? This is something which has evolved very, very fast, right? I think it is going through its own self-driving problem, where we know that a robot probably drives the car far better than a human and has much lesser accidents. But society is still not ready for it, because when something goes wrong, they need to hold somebody accountable. Right? So there are probably models, you keep seeing models are getting better, they are passing all the exams, they are detecting cancer better, they are analyzing the pathology reports better and diagnosing better. But people are still scared, because if something goes wrong, then who's accountable there, right? But in some spaces, breakout companies have been formed, like mental wellness. We have been early backers of a company called Visa, which has done really well in this space, right? And just try to humanize it a lot. So the acceptance has gotten much better. And so, all these things will evolve, and I think the ultimate frontier is that patients who have, or people who have no access to physical facilities or doctors, are able to get the same standard of care, and that the regulations have to support it to be able to do that, because I think that is where the issue really is. It's not technology per se. Technology will evolve much faster than regulators, right? And there'll always be people who will try to push the envelope much farther in this, and that's what, at least from a venture capital standpoint, keeps us on our toes and keeps us excited. And and I agree to all the panelists here that at least for healthcare, it's a fantastic moment to be in, and it's a huge boon if we are able to harness it well.
So Dr. Porwal touched upon the point of a lot of data which we now have at hand due to AI, and we have seen just recently a lot of data breach cases. So when AI has got all that sensitive information of various patients, how are you preserving that? Can you share your thoughts on that?
Well, to be honest, healthcare is actually lagging behind compared to the financial sector, right? So you have today in India far more stringent regulations across that financial companies have to comply than companies dealing with medical data. But I think that has both advantages and disadvantages. The advantage is that we are able to innovate a lot faster, which would benefit India far more than the other countries. So I'm hopeful that the one important step that my panelists described, what we're lacking today is a UPI moment in healthcare, right? Where data which exists in, well, I would say 70% of all medical data today is either offline in somebody's file in their cupboard, right? Or just not connected to an ID. And the government's framework for Abha, I truly believe is a remarkable framework that would again leapfrog us going forward. A lot of thought has been put into data safety and data privacy. My colleagues would be far better informed than me on this. But the universally in medicine, okay, unlike, for instance, copyright issues that you have in creative content for creating large language models, I think the medical community is far more open and has learned how to de-identify patient data and protect their privacy. And that data, they are more than happy to collaborate with model builders and AI developers. So I think medicine as a profession, they've figured out data privacy and they respect data privacy and at the same time are open to collaborating. So I think this dichotomy that exists in medicine, I am hopeful that with the advent of things like ABA, will over the next decade, will leapfrog us from a data point of view to the rest of the world.
Well, I can't add much to it. As Doctor rightly said, that the digital public infra, which is what we did with financial payments and UPI transactions, I think will definitely leapfrog us as a country. And I think that's the scale at which we are looking at, I think it warrants large structures. But at the core of it, the issue still remains on how do you get all of the healthcare past history medical data, because as Ankit was also mentioning, data is the backbone of all such models, right? And unless we contextualize medical progression, disease progressions to the Indian diaspora, Indian context, I think we will still not be able to beat the curve, right, in terms of clinical decision making. Short of that, everything else, I think, to support clinical decision making, I think I'll take Gaurav's point there, B2B2C. I think that segment has a lot of promise in itself. So, yeah.
So, like I said, like the idea of getting the data together, being available at the point of care at different places, and data security, like obviously different regulations, right? We play in a market which is very highly regulated, right? With all the kind of standard that can possibly be, right? Be it high trust, HIPAA, SOC 2, and now as we are going into the government sector, even FedRAMP and so on and so forth. So security, even when we started in healthcare, was the first piece that we tried to get to. Like, how do you get to end-to-end encryption? How Dr. Charak was saying, like getting those tokenization, how you de-identify data, right? Because if you want to create benchmarks, if you want to create algorithms, that is the first piece that you have to get to, right? If you are getting all these things. And around health entities being really open to collaborate, like we have integration with British Medical Journal and so on and so forth, who share those pieces, share those studies to create the right care guidelines and help in building those clinical decision support over there. Integrating with the pharmacies now, right, with the research organization, which is where we see the last piece of how do you help the data that now that you have around patients, around different cohorts, on drug discovery, on drug trial, and how getting them into production and drug effectiveness much more faster and much more better. So the avenues, if you have the data with the right cohort, with the right tagging, with the, and clean and organized, and build the right algorithms on top of it, keeping it secure and regulated over there, the possibilities will keep on increasing. I think for the Indian context, as Vishal was saying, is very important that, and maybe AI can play a huge role in helping in digitizing that data, which is right now sitting on files, right? That before getting to the care delivery, if you are able to invest in the AI, that how you can just keep uploading your files and there's the AI is just digitizing it and putting into a format, right? Because now you have well-established data standards like FHIR and so on and so forth. It can help creating that data for India. And then you can build your clinical models, which are much more contextual to the India diaspora and basically the Indian healthcare history and patterns is how I feel we can leverage that. Yeah.
No, I think from a data privacy standpoint, again, AI itself, you can use AI to do exactly that as well, right? So it's a, so while one side of technology progresses, there's a lot of work happening where the models can redact all the PII right? So you can do that at scale, right? So there will always be these counterbalancing forces that will be at play, and I think it should not be that big an issue, especially with the, there are examples to follow like US markets or like European markets, which are very, very clear about these things, and people will figure out how to build, what we need as a society within those, within that box, and hopefully with time that box will just simply keep expanding for better of everyone, yeah.
Okay. So at this point in time, do you see from policymakers' side, like you just mentioned, are there any interventions required or new kind of framework which is further going to help?
That's for him.
The central government's push to Abha, I think, is going to revolutionize healthcare in India. It is going to be a very, very difficult journey for clinicians such as me. Believe me, even today, I write my prescription on pen and paper. And that's what the patient expects from culturally. Right? So if I say, well, my secretary will print it out outside, the first question they say, but doctor, you have not written anything. So I think the transition for people such as me to go from analog to digital is going to be one of the most toughest challenges, much tougher than passing medicine. And that I see common for lots of people of my generation. I'm hopeful that the newer generation are far more apt at this than I am. So the policy change that they want to bring in Abha, I think, I would say, it is equivalent to us going to the post office and sending money, and that's how I would get money from home when I was studying in college, to now UPI. So that regulatory changes that are there are being done slowly and gradually, but there's a clear direction amongst everybody in the government that this is the right way forward. And I do believe that it will not just reduce medical errors, but also bring down the costs of healthcare delivery at a scale of a nation.
I think to add to it, there are two parts that we would expect as healthcare providers. Being on one side of it is, I think, fair participation or a voice in terms of defining the regulatory frameworks, right? So to that extent, the government has done well. ABHA is one example of a national digital, ABHA falling into the National Digital Health Mission is a part of it. I think there is a genuine need to accelerate some of these things, right? The second is, I think healthcare industry in general, as you said, data privacy and all, I think that's table stakes now, right? Most of the healthcare entities are getting listed now, right? So there's a self-check mechanism that is getting deployed in itself. I think what needs to be done is, can we create enough incentive mechanisms around digitizing the underlying base data layer, right? And healthcare still is, delivery and consumption both, is largely fragmented in the Indian context, right? A lot of healthcare actually gets consumed outside of the hospitals from a volume perspective, not from a value perspective, right? So there's a lot more to be done. I think if we can accelerate public-private partnership towards some of these mechanisms, I think building AI would be much easier, right? And accelerating this growth will be much easier.
Okay.
Yeah, no, sure. And I will take few leaves, from how US did it, right? Even at that time when the Obamacare came, the mandate. So I think with ABDHM and Abhar, building out the framework, I think India has been doing great. But with, India comes with a huge amount of problems with the population and the vastness of the geographies from north to south and east to west. But there, it was easy for them to, not easy, but it took them 10 years, even after mandating, that everything that you do has to be documented over there. And it was a hard thing, it was the biggest difficult piece for the doctors, right? There are so many memes when we entered healthcare around doctors hating the IT, that we took medicine to treat patient, not to be a data entry job and basically entering everything into the computer. But they had to do that because that is how they got paid from the government. So that was both the carrot and the stick, that they were incentivized to adopt technology, that yes, everything will be subsidized. If you get a software in your hospital, 80% will be subsidized by the government. So there was an incentive, but there was a stick to it as well, that if you want reimbursement to happen, because one of the biggest insurer in the US is the government, which in India is also now developing with all these different schemes where they are insuring the underprivileged and so on and so forth, that the government is also becoming a payer, right? So if you want to go get those reimbursement, you have to prove with data. It can't be with paper record. So that both incentivized people to get into that bandwagon of digitization. So I think how do you mandate that? Maybe start with the government clinics and so on and so forth. And one piece that I see which can really help now with, like, say, things like ambient documentation and so on and so forth, where everybody doesn't need to go into a computer and key in everything, and you can just be talking to your patient and it will digitize everything on the background over there. So I think AI can really help in getting the adoption much more easier, right? Because training each and every physician sitting in different parts of clinics and making them trained on how to do a data entry job, and it might just increase the cost where you have somebody just sitting who is documenting that thing over there. But with AI, you can solve that pieces and increase the adoption or accelerate the adoption. But still the regulations of that, somewhere in the mandate in the nature has to come from the government to, because it's a huge, I will say, friction to get from where right now the provider is, because that problem still happening. Like, if you're not entering into the computer, you can see 20 patients. If you're doing that, you might be able to see only 12 or 10, right? So how do you get past that friction? I think with the mandate and with technology, we can solve that piece.
Sure. Gaurav?
No, so see, I feel that regulation, Indian regulators have been generally sort of very progressive. Generally, I think healthcare has very unique challenges, right? So, we would like the UPI moment to happen, but see, UPI was very simple, right? The banks were digitized, and it is essentially electron transfer, right? But when you throw atoms in the mix, right, and it is not even simple e-commerce where goods are moving, right? Here, people are moving, medicines are moving, there's an insurance, there's a hospital. The mix is extremely complex, right? And also there is immense amount of vested interests where people just don't want to digitize anything, because that documents, if you have misdiagnosed or you have overprescribed, it is all documented. If you are, if your financial transactions are not above board, then you have absolutely no incentive to digitize any of this, right? And so, the point being that and given India is mostly an out-of-pocket market, right? The hospitals or providers have no incentive to listen to government, right? So in US, why it is so advanced that it's very clear: you don't listen, we don't pay. Very simple, right? Patients cannot assert that kind of power on providers, right? So the government, along with the regulatory framework, also sort of has to figure out how to enforce it, whether through financial means or non-financial means. And that's why, we have a great framework, but probably it will take a fair amount of time for it to kind of get implemented, unless there's a real incentive for people to do that, to digitize everything, right? But it's frankly, the ambiguity around this is very rewarding to a lot of people in the ecosystem, right? So we shall see, right? So I don't think regulators will always be ahead of the curve, but it is the overall ecosystem that has to evolve to be able to match up to it and provide the right service.
So, Doctor, I would like to, again, chip in you, and probably you can answer this question. I mean, do you think these kind of practices can be adopted in India, as we have seen in the West?
I think a very beautiful point was made about the carrot and the stick. Right? And what we should do is actually learn from the West. Learn from, as he said, physician burnout. Right? It's a significant problem in the West. And now with even smaller number of physicians who have much higher workloads, perhaps we should think of different solutions over here. And my hope, and I'm always very hopeful that we will have our 3G moment as well, where we leapfrogged over different technologies. And to me, the reason why I'm very hopeful is the number of lives that we can save, the sheer impact that can happen with technology, with AI, is immense. Right? And for example, if I'm able to control blood pressure better, I can save a stroke. Right? And to Vishal's point, that 60% of everything that is done in the hospital with my patient can be done at home. Right? Saving costs, right? Saving convenience. And with societies going older and the gap between health span and lifespan only increasing, I'm hopeful that AI would play a pivotal role, especially in our country where the impact would be tremendously high.
Vishal, any closing remarks from you before we open the floor for questions?
I think very pertinent points made. As I said, the healthcare is one of the sectors that's very purpose-led. Right? In India, private participation in healthcare is far greater. Right? So to that extent, I think, and we are all very cognizant of the fact that AI can deliver a lot of advantages as opposed to the disadvantages of using the system. There are parts to the puzzle that we need to solve as providers, which is how do we get the right data into the systems, etc. Enough and more protocols, which, as was rightly mentioned, that there is no misdiagnosis or overdiagnosis. And I think part of using technology will also solve that, right? Because there are individual ways of treatment, etc. the doctors follow, right? So I think everybody would welcome standard operating protocols there, right? So as I said, we are a country where healthcare crisis is very real, right? And technology is one thing that nobody on this table or sitting opposite would ever bet against, right? So if as a sector we wake up to technology sooner, I think there's a definite win-win on the table.
Any closing remark?
No, I think from the closing piece, I think great points have been made. And when I will say like the regulations and the norms will happen, but even from a tech innovation point of view, reaching the last mile of consumer and the provider and helping that, I feel there have to be technology that have been built in India for the Indian ecosystem, and a lot of innovation, a lot of the startup ecosystem has to start investing towards that. Yes, we might need 10-minute delivery for our confectionery items, but how do you get or put real brains of solving the problem for the providers, for the patients, might not be the most glamorous problem to solve, but I think innovation and investment is needed for the brightest of the brain to be investing there, because that is what is going to save the future and not the 10-minute delivery of my chocolate. Yeah.
Okay, Gaurav.
So, I think, it is very clear that march of AI in healthcare is inevitable, right? And it's by need as well. It's not something that is going to it will be net positive to the sector. But I think healthcare probably will be the sector that will drive the humanizing of AI, because that's where you need it the most, right? Because, all the other sectors, AI can be very, very transactional, and it's perfectly okay, right? But how AI can be more and more human, and how AI can be the package that you put on AI, mimics more of human emotion, the need for people to feel cared, and not in a mechanical way, but in a way that they are sort of used to, that they deserve, right? And that's why I'm like very excited about this field, because healthcare's effect on AI would probably be not just in healthcare, but across the ecosystem, and just making it a more, a net enabler for the society as a whole.
Okay. Even I'm waiting for those AI prompts, the way we get it for our online shopping or various other things where, of course, probably it can tell my parents, okay, when is your next health checkup due, when is your medicine due, when do you have to order your medicine, have to eat them. So all those things, I hope we could, further AI prompts can help there. So with this, we would like to throw open the floor for questions. If you have any questions, please raise your hand, identify yourself. The gentleman here in the front has a question.
I am Dr. Uma Shankar Mohanty, and I am the founder of Manual Therapy Foundation of India, where I give trainings in advanced physiotherapy in many countries. My question is for Dr. Charit. Sir, I should congratulate you that being a cardiologist, you found some time for entrepreneurship. Just wanted to ask you that in your practice, to what extent do you find artificial intelligence to be completely, you are completely dependent, or it is augmenting your practice? I mean, as far as the patient point of view.
So, and let me be very open and honest with you, sir. Today, in my clinical practice at one of the large hospitals here in Bangalore, the amount of AI that is used is close to zero. Okay. Take from the time that I see somebody at an outpatient, schedule a procedure or an angioplasty, for instance, just now, prior to this, 2 procedures were done. The technology that exists that I'm using to treat my patients today, the compute power, for instance, in that workstation that powers my cath lab machine, your phone probably has much higher or much more latest processor than that device that is there. So the point I want to say is that the gap that exists today, where AI can be a benefit, helping patients first and doctors, as rightly pointed out, for instance, medication error happens in 22% of prescriptions. Some minor, some major. So the scope of AI coming into my day-to-day practice is huge. The opportunity that is there in front of us is massive, and which directly translates to not a faster home delivery, but a better diagnosis that is there, a better treatment that is given, and precise medicine for the right person at the right time. So I'm very excited about the promise that AI has in helping my patient journey and helping me solve my patient problems better.
Sir, you will, as a practicing, doctor, you will agree that every patient we come across is completely different. Maybe with the same patient, but then approach of treatment is different. A lot of complexities are there. Plus, living in era of evidence-based practice, every, I think, month literatures are coming. How to inculcate them using the technology is one of the biggest challenge where we all have to, combinedly work at. And I would like to just share with you, sir, I think all of you, a recent journal, because pain is one of the major component, and IASP, International Association for Study of Pain, is one of the very standard organizations in the world as far as the pain management is concerned across the various healthcare professionals involved with it. The March issue of the Pain Journal has one important article with one editorial related to the LLM. They have used the GPT-4 plus Gemini, and they have found out that there are a lot of discrepancies as far as the prompts and the outcome which has come. I think maybe somebody was telling about LLM and SLM, and can you put some elaboration how it can be inculcated, putting the researches, putting the clinicians for a better package to the patients? Thank you.
Yeah. No, I think and very accurate use case that you just pointed out, right? That when so much research is happening on a daily basis, how do you keep the providers updated about those things, right? And at the point of care. And one of the solutions that we work with the likes of Kaiser is like, and integrating with these journals, like the British Medical Journal, the North American Journal, and how do you keep getting that data in with all these, I would say, the third-party sources. be it Elsevier data, be it the Walter Kluwer's data. How do you get those pieces in, the research pieces in? You have the patient history, and then you have all the evidence base that those clinicians have prepared themselves. And SLMs, this is one biggest use where the LLMs and the SLMs have proven their piece, that they can take large amount of information, process that, and predict with a good amount of accuracy over there. And as much as you train on the right set of data, the hallucination keeps on reducing. So this is the one use case that over the time, in the last, 12 to 18 months, where the Gen AI has been becoming more and more popular, they have got a very solid use case and have proven their mettle. And that is why this is the use case that we have been working with the providers, helping them in differential diagnosis. That once you are seeing the patient and the patient has described those pieces, and you have all these research, because it's almost impossible to be reading each and every research paper, but the AI can do it for you. And they can surface, okay, they're not directly interacting with the patient. They're, for us, it's what we call the co-pilots. It's working with the providers and just giving them another kind of a peer specialist who can help them in differential diagnosis, and it is their decision making. Do they want to absorb something from that, or they want to neglect? And we take that feedback, that how much of that was thumbs up or thumbs down, so that we can feed back into the system that how good is our fine-tuned or retuned models are working. So we have been using that piece specifically for that purpose.
Okay. We have one more question here.
Well, gentlemen, panelists, good afternoon. I'm Dr. V.K. Chaudhary, professionally neurosurgeon as well as trauma surgeon. Well, I'm working in the government as well as a private hospital in Kolkata. Immense experiences while working in the government.
Please bring the mic closer.
Immense experiences in working while in the government, right from the rural areas to urban area, right? Plus, I'm an inventor scientist also. I have my own startup company, Jadunix Made Molecules Innovations Private Limited. And I invented quite a good number of devices for the entire operating or non-operating devices. I just wanted to draw your attention that India is such a vast country, having 140 crores of populations. As a matter of fact, demographically, we have rural populations and it was urbanized, so I understand 75% of the population, they live in villages, and only 25% populations are urbanites. It's again astonishing fact that entire corporate hospitals, as well as government big hospitals, are giving tertiary cares are located in either state capitals or few districts, not all. How do we managing, for so far, the entire 75 population is they are thrown by the quacks and rural healthcare practitioners, with the non-educated ones. They just learn something as a compounder and then switch off to the villages and start doing practice. How AI can, that's why I have another company which is doing telemedicine also. Now what we are doing, we are communicating with those rural populations of practitioners. They have basic infrastructures of beeper machine and that gives you some inputs of vitals. And then on the side, we are having all panel of specialists and super specialists. If you visit the rural practitioners, they're having, suppose, 15 patients, and all having a different specialty needs.
Please come straight to the question.
Yeah. So what my question is, how AI is going to control all these discrepancies, how we take AI into the care of these telemedicines so that we give befitting care and to the rural populations as well as the urbanites ones. Because again, it's a 75% population you cannot ignore. We are heading towards Modi ji's vision, India to be a developed nation by 2047. And what are we doing? Our 75% population is just like that.
Okay, let the panelists answer.
Let me attempt to answer it. I think part of the question you've answered yourself, and I think it comes from your experience of doing this. See, the issue in healthcare delivery is not intent today, right? It's practically supply. Do we have enough doctors and nurses available, and would you want to practice in those areas where you need to reach the masses, right? So it's more a problem of supply than intent or capital, right? That's point number one. And as you rightly said, if we have to take care into those areas, what is it that we need? I think screening and diagnosis is the most important. how early do you identify diseases at scale, right? How do you screen populations at scale? Until now, I think government, private, they have equal participation in this. There is rural health as an agenda that is being taken up, but if you have to deliver anything at scale at low cost, I think technology itself is a solution, right? So the answer is within the problem itself. So there's an opportunity there to do mass scale rural health screening diagnosis programs, and as Dr. rightly pointed out, the concept of unique health ID will just make it even more interoperable, right? Then when a patient is moving from those areas of screening, etc., to, because you'll still have to travel for healthcare. I think we're still not at a point in another decade where you will have hospitals in across rural, etc., and super specialists available. That may not happen. So you will have to do primary and secondary care to an extent, which is aided by technology, clinical decision systems, probably adequately funded by the government. You have Ayushman Bharat, right? But we've seen cases of misclaims and overclaims, etc. So I think use of technology as a common denominator across reducing the cost to service, having longitudinal data available to physicians, so that if at any point in time these patients have to travel, there is enough information available to reduce the cost to treat the patient in the urban cities. Because today what happens is the patient has to travel, you have to do a battery of tests, make them stay. So it adds to a lot of anxiety, cost structures, etc. So I think the answer lies in the question itself. So thank you.
All right. Thank you. That brings us to the end of this session. And thank you so much for sharing your thoughts and insights with our audience.